Makers tonight ramping up calls for the State Department to stop issuing visas to travelers from West African nations affected by the Ebola outbreak. Incredibly, some 100 people each day are still applying for and being issued visas in Guinea, Liberia, and Sierra Leone to travel to the United States. Those are, of course, the three hardest hit nations from the Ebola outbreak. House Foreign Affairs Committee Chairman Congressman Ed Royce is leading the effort to halt those visas, and we will be talking with him on this broadcast shortly. Joining us now for more on the Ebola crisis, Dr. Saul Himes. He's Assistant Professor of Pediatrics and Pediatric Infectious Disease at Stony Brook University, and Betsy McCaughey, the former New York Lieutenant Governor, a chair at the Committee to Reduce Infection Deaths, and Senior Fellow at the London Center for Policy Research. And as you both know, tonight Nina Pham, the first nurse to be infected with the Ebola virus while caring for a patient, and we're looking at pictures now from Dallas as she is being transported to an airplane to take her to a National Institutes of Health Clinical Center in Bethesda, Maryland. I want to get from both of you a sense, and let me begin with you, Doctor. A lot of people are questioning the hospital in Dallas, but I mean, where do we turn? I mean, the administration is making no sense on this travel ban, in my opinion. It's the most illogical piece of reasoning and this administration is strained at the record levels of that. But this is something new. Your reaction to what's happening in your profession with this Ebola outbreak?
Sure. I think what's happened in Dallas has shown us that what's really important is people do keep talking about protocols and having protocols in place and the CDC issuing communications to hospitals. It's important that places practice those and review them. This Ebola outbreak in the U.S. is a new phenomenon. Many local hospitals haven't seen anything like it. And I think what happened in Dallas sort of drives home the point that we all need to be on top of our game at practicing and rehearsing and drilling and going over techniques. Let
me ask you this, Betsy. I mean, we know that Dr. Frieden has been aware of this and has been calling all of us to attention on the issue since March. Yet hospital after hospital doesn't know anything about the disease, how to prevent it. And they have had the choice of having a ban put into place against those countries, against those folks who would travel from Ebola-stricken nations. Are you disappointed that they've done so little in that time?
Oh, I'm very disappointed, and the need for the ban is obvious. First of all, I've spent a decade in hospitals advocating for patient safety, and I can tell you from experience, hospitals that can't stop the spread of staph, C. diff, and other common infections that kill 75,000 people a year in our hospitals can't contain Ebola. The bigger shock, the real news, is to see what's happened to the CDC under Tom Frieden. He has presided at an agency that was once respected and now, frankly, is now the Centers for Denial and Confusion. He has become a sycophant, speaking for the White House instead of looking out for the safety of the public.
Well, he was a public health director for New York City. He is a bureaucrat, and he is a political creature.
His obligation is to keep America safe. And when you watched him squirming in his chair today, consider this. He didn't include on his list of people in Dallas who were under observation the 77 healthcare workers who had directly taken care of Mr. Duncan. Why? Because it would have made the number of people under observation so large, over 100, that the PR would have been terrible. That's how this woman ended up on an airplane.
Dr. Himes, in your judgment, what should we be doing here? And again, whether we use the word or it's others, protocols. What in hell do we mean when we talk about protocols?
Sure. I think you make a very good point that we have outbreaks of resistant bacteria, of C. diff, of infections like that, which again drives home that we need to do a better job with personal protective equipment, with things like that. But I think more importantly, though, for Ebola overall, and really even for Ebola in the U.S., we need to get control of the outbreak in Africa, and I think that's
all well and good.
Essential point.
But my question is this: there seems to be here a confusion at the CDC between the CDC's responsibilities and those of the World Health Organization. And if that confusion then extends to our doctors and to our nurses, then, where do American citizens rate in terms of their responsibility? And right now, I would say to you that we're not treating those nurses very well. And the American public is scared to death, Doctor, as you well know.
Sure.
And it's about time some people started talking sense here. What are we going to do?
Well, first of all, treating Ebola is such a perilous mission that doctors and nurses who are fully equipped in the proper protective gear that the CDC failed to call for the first time are getting Ebola and dying. 277.
I want to explain, if I may. The ambulance has arrived at the airport to put her aboard that aircraft that will carry her to Bethesda, Maryland, to the National Institutes of Health critical care unit, and it will be obviously a quarantined unit. I don't know what level, perhaps a level 4 facility, but at this point it will be one of the very best, if not the best. There are two beds, I understand, at that facility. So we wish her the very best. And I'm sorry, go ahead, Betsy.
Well, it's a perilous mission. 277 doctors in Africa, doctors and nurses in Africa have died taking care of Ebola patients. Many of them had complete training over just this year. Just this year. Many of them had adequate training and very good protective gear, including 9 Doctors Without Borders. The nurse in Spain treating an Ebola patient who is now clinging to life because as she was removing her protective gear, her finger, with gloved finger, touched her face, is now facing death. Our nurses and doctors in this country shouldn't face that ultimatum of perfect performance or death.
I'm very concerned about our troops that are being sent to Africa. We've heard 2 stories about whether they will be in direct contact with patients versus handling the virus. That would be the mobile labs that are being set up, Doctor. I am concerned that the Centers for Disease Control have been so lax that there is not proper training for our troops. These troops volunteered to serve the nation. I think it's a considerable stretch to demand of our troops and order our troops into a situation where they will be facing the same jeopardy that Betsy has just described.
Well,
don't you?
I think that the Army and the troops and our armed forces are actually some of the best equipped to help with this, both from the standpoint of logistics, which actually
have they ever at any point been involved in an Ebola epidemic? Have they ever once had to deal with it?
I can't say for sure.
My point being, I am as pro-military as anyone you will ever meet. I don't know of a single instance of their training in dealing with a deadly epidemic.
They get constant training and exposure to biowarfare and exposure to chemical agents.
Nuclear, biological, and chemical warfare.
So they're probably better trained than any of our doctors.
That is a very select, and I mean select, group of our service members who are trained in that area. I appreciate it. We're out of time. Thank you both, and hopefully somebody will come to their senses at 1600 Pennsylvania very soon. Thank you very much, Doctor. Appreciate it, Betsy.
Thank you.